Sam Towers Podiatry in Sydney CBD.
Today, myself and Sam here are going to talk about a condition very common, cause of heel pain called plantar fasciitis.
Yeah, plantar fasciitis usually is caused by biomechanical imbalance, which if it is, that's where we come in. Basically what we do is do a video assessment and work out exact cause, which it can be a malalignment. Basically the muscles underneath your feet are overworking to try and stabilise some imbalance in the foot.
Yeah, the causes can be an acute cause as well, so you can play a game of touch football, for instance, and do a little strain, and then this becomes a chronic problem. So we sometimes set off an ultrasound to just investigate the extent of the micro tears of the plantar fascia, but most of the time just by palpating we can diagnose the condition of plantar fasciitis.
So symptoms usually, we're looking at pain in the heel in the morning, first thing, can go away over that first 5 to 10 minutes and then return again after activity later in the day or after standing up after exertion. Can look also, we can get burning pain, that's when we're getting a little bit of nerve entrapment, but basically an achy pain of the heel or arch.
Yeah, yes, that's right, Sam. Now, I'm just going to talk about the treatment. Short-term treatment can involve a strapping to relieve pressure off the actual heel area. They work quite well short-term. More mid to long-term things where it's becoming chronic, we've got to treat the cause, and often it's an imbalance of the foot moving the wrong way in gait or when you're running. It causes too much strain on the insertion of the plantar fascia. And
it's basically like jumping on a guitar string. Over time, where it attaches at the back, you start to see pain and a pulling or traction of the attachment point.
Yeah, so the treatment there, short term was the strapping. Mid to we're looking majority of the time to treat the imbalance of the foot, an orthotic, a customised prescription orthotic device made specifically for you. And we're using 3D scanning, myself and Sam here, to fabricate the devices. We do find that the accuracy is quite superior to some other more traditional
handmade devices,
more traditional methods.
Moving away from that. With the treatment, sometimes we're deflecting pressure away from the heel attachment point. So we've got codes where we're deflecting pressure off the scan, off the points of pressure, putting in plantar fascial grooves, which are the muscles, allowing the muscles to move naturally across the orthotic without blocking normal movement. Once we get the patient in the right position, things start to settle down. Other modalities of treatment can also be brought in after that period, some anti-inflammatory, sometimes cortisone injection as a last resort, but primarily treating the cause of the problem individually, and things settle down usually between 3 and 6 weeks.
So plantar fasciitis, if you've got the condition, come and see myself or Sam and we can sort it out for you.
Thank you.
G'day, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam from Sam Towers Podiatry, Sydney CBD.
We're going to talk about a condition that probably a lot of people are suffering from after the City of the Surf yesterday, basically. It's Achilles tendonitis.
Well, Achilles tendonitis presents as pain at the back of the heel, around this area. Tendonitis meaning inflammation, can also incorporate some thickening, soreness, extending up the calf and then down towards the heel area, basically the back of the heel.
Can get sort of two major types. One's insertional Achilles tendonitis, which is right on the actual bone attachment, and the other one is a little bit more distal, sort of the mid-belly, but this is a region that is affected.
Symptoms usually present after activity or first thing in the morning, getting out of bed, a sort of stiffness or inability to really push off your foot. And that's when people start to think, okay, coming in to see us for an assessment. Usually, sometimes in the chronic, more chronic phase, but acute phase, they might present to a physiotherapist, hopefully refer back to us.
Yeah, the idea is what we do as podiatrists, we look for the cause of the problem, pinpoint the cause, often through video assessment or it can be footwear problems as well. We treat the cause and then the symptoms generally go. We sometimes get an ultrasound done to get the extent of the injury, but that would have to be if we're possibly considering it's a partial tear or rupture, in which case treatment would be into a boot. But for sort of minor sort of chronic problems, we often make an orthotic but get the heel balanced properly, Sam, and that tends to work quite well.
Yeah, usually it's more the in and out movement of the Achilles tendon rather than the up and down movement of the foot that can create this extra tension. Basically a piece of rope that doesn't like getting hit from the side. That's the analogy. But after video gait analysis on our iPads, walking and running analysis, freeze framing the gait cycle, pinpointing what cycle of the gait the problem's coming about, then treating that cause being a malalignment in the foot via customised orthotic, which we 3D scan the foot now and we get a very accurate impression, getting something back to you quickly and then monitoring you closely over that possibly 6 to 8 weeks for something like that, being Achilles tendonitis.
Yeah, so we get quite good results. We do work with massage therapists and physios to do some hands-on stuff as well. That definitely helps. But generally, Achilles tendonitis can be sorted quite quickly and effectively. So yeah, make an appointment with Sam and myself and get onto it.
Thanks, guys.
Thanks. Yeah, hi, I'm Pete from Charlestown Podiatry Clinic.
And I'm Sam from Sam Towers Podiatry, Sydney CBD. And today we're going to talk about bunions. A quick chat anyway. Sometimes called hallux abducto valgus. Basically, hallux, big toe. Abduct does that. Means that bone sticks out. That your toe starts to move sideways. Causes an ugly bump eventually.
And
which can
painful.
get very painful, yeah.
It hurts.
Talk about some of the pains we're getting, Pete.
Yeah, the pains we get for this condition generally can be varied on top of the actual joint, so it's right on top of the big toe joint. Deep ache, pain on the side of the joint, also a deep ache. You can also get a pain underneath the joint, which is technically a slightly different condition called sesamoiditis. However, the location of the pain is pretty much the same all around the big toe joint. Deep ache, very painful on push-off, when you push off on the ball of your foot.
Exacerbated by poor footwear, obviously. So women's shoes basically create a bunion. But there's also a genetic predisposition which guys and girls can, they can cop bunions at an early age as well. So it's not just high heel shoes that create it. So a lot of males, runners, people standing up all day, they'll present with a bunion. And yeah, they're not wearing high heels.
That's right, Sam. So yeah, with treatment for this condition, now there is surgical treatment which traditionally has been not great. However, they've improved their surgery dramatically. Where we come in, most of the time we offload the joint and with an orthotic in the shoe to get the joint moving properly, and i.e. pushing up
Or glide.
and that's done with an orthotic to go inside the shoe, and the pain will go. So we find the orthotics, if they're made properly, work really well to get rid of the pain. Sometimes if there is a large bony exostosis or bump, surgery is an option, but for pain relief we find that podiatrists with a good pair of custom orthotics works really well.
Long term as well, in that we're stopping any further degeneration in the foot and basically stopping that joint from aging, trying to prevent arthritis. So yeah, please come in if you're getting any of that bunion pain, we'll sort you out.
Yeah, nice and early.
Thank you.
G'day, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam Towers from Sam Towers Podiatry, Sydney CBD.
Today we're going to talk about a condition that a lot of people will be suffering from now with the running season in full swing. See the surf yesterday and some triathlons and some long distance running programs sort of starting to take off. Hi, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam Towers from Sam Towers Podiatry, Sydney CBD.
Today we're going to talk about a condition that is quite relevant at the moment with the increase in running events at the moment and triathlons coming up. They're called shin splints. That's a generic term, but an anterior shin pain is what we call it.
Yeah, so basically pain in the shin usually presents as achy pain in the bone. It feels like a bony ache and is basically caused by that muscle that attaches on that shin bone, which are these sort of muscles here. Overworking, usually due to, could be, and most likely due to excess movement in some of the joints of the feet.
Yeah, and also it can be due to some muscle tightness, but probably a combination of the two. There's generally an imbalance within the foot structure, and that puts the pressure up through the shin area.
So the shin splints, they're basically the two major stabilising joints of the feet, tibialis posterior, tibialis anterior, and after we've done a proper video running assessment, then we can formulate a treatment program based on the cause of the problem, and everyone's different.
Yeah.
So that's where our 3D foot scanning and digital gait analysis comes into play.
Yeah, we pinpoint the problem, the cause of the problem, treat the cause, and then the symptoms will generally go. So don't put this one off because it can become debilitating. You can, if we're left, it can be a 6 to 8 week in a boot. So if there are first signs of this condition,
we really want to avoid a stress fracture. Yeah, if people start to push through, so don't push through the pain. Just come straight in.
Yeah, make an appointment with myself, Pete. Come and see Sam, and we'll get onto it. Hi, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam from Sam Towers Podiatry in Sydney CBD.
Today we're going to talk about a common condition. The symptoms generally are pain in the balls of the feet, and some can be a burning pain or a deep ache right through the forefoot area.
This area here, front of the foot.
So metatarsalgia is a common term used. It's the pain is quite severe, can be burning, tingling, and sometimes associated with numbness. So we're going to talk about what we can do to treat this condition today.
Basically, treating the condition involves treating this transverse arch, which is where that spring is. Basically, you want the forefoot or the front of your foot to be convex, like the Harbour Bridge, and problems arise when we get a change in that position, a concave or reverse Harbour Bridge, and then we start to see excess pressure across one of the balls of the feet.
Yeah, we can also get a thickening of the nerves at the forefoot, and that would be, it's technically called a neuroma, and that's diagnosed under ultrasound. But the treatment is generally to offload the ball of the foot, the area that's tender, and the symptoms go.
Yeah, just distributing the pressure more evenly across the whole foot, even taking pressure off before you even get pressure off. You put pressure on the front of your foot, can relieve symptoms.
So how we do that is, firstly we get women out of silly, stupid shoes. That can be
Major cause, yeah. 100% of your body weight on sometimes 3 bones, and most people have 5. You start to see problems.
Yeah, so we look at the footwear, 1, 2, we also look at the actual mechanics of the foot inside the shoe. That's where we look at the way people are walking and running. And we often offload the area with an orthotic device. Generally we use a lot of these in this condition, which is a metatarsal dome, it's called. And that's positioned where the tenderness is, or just behind that actually. So we find that by offloading it with a well-made custom prescription orthotic with a metatarsal dome, quite effective to treat the condition. So don't put it off, come and see myself and Sam, and we'll sort it out for you. Hi, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam from Sam Towers Podiatry, Sydney CBD.
Today we're going to talk about pain that is not actually associated within the foot. A lot of people think podiatrists just deal with foot pain. We deal with a lot of knee, hip and lower back problems as well. So we're just going to have a brief discussion on what we can do for these debilitating conditions.
So basically, if you're getting knee, hip or lower back pain after long periods of standing or walking, then you naturally should have a look at your foot function and getting your feet assessed.
Yeah, so it complements well with physiotherapy, chiropractic and osteopathic treatments, but often we've got to look at why is this becoming a chronic knee, hip or lower back problem, and a lot of the time it can be foot related. So I think we should definitely get it looked at quickly if you can.
Particularly if other treatments aren't working, and then you're having to continually go back to that practitioner and the same things keep reoccurring, then particularly after a long period of standing or walking, please come in for an assessment and let us check your feet out so we can fix your knee, hip or back and then get back in your activity.
Thanks Sam. Hi, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam from Sam Towers Podiatry.
Today we're going to talk about our nemesis, the traditional rubber thong.
Yeah, the double plugger, the flat version.
The things that keep us busy.
Yeah, coming into summer, we're going to see a lot more thong wearers. Very popular in Australia with the climate. Basically, you should be limiting your thong wearage time to less than 20%.
Yeah, if that. However, we do see the need for some people who are in work boots or enclosed footwear. They do feel the need to air their feet after the end of the day. So thongs, there are some thongs, not many, that are actually reasonably good. I've got one here. This is an orthotic thong, which they've recently developed, which we sell here at Charlestown, and it's quite good. It does relieve the pressure off the heel. So if you are going to purchase a thong, have a look for something with a bit of structure, a bit of arch support.
Cup the heel as well, so it holds the heel in, so you don't get cracked heels, basically you're looking at cracked heels and hammer toes as the problems that come about after long-term wearage of thongs.
So yeah, there are some decent thongs out there, but they do need to be specific in that they have some support. So yeah, have a look, have a feel, twist them, turn them. The more support, the better. Hi, I'm Peter from Charlestown Podiatry Clinic.
And I'm Sam from Sam Towers Podiatry, Sydney CBD.
Today we're going to have a brief discussion on kids or children's feet and just talk about what we can do for them as a treating podiatrist.
Some of the pains or aches or conditions that we like to get on top of early are really looking to assess kids usually between the ages of 3 and 8, or earlier is better than later. So if we can get some form of intervention around the age of 3, then we can make a big difference permanently through those formative years.
Yeah, we get some structural change with the bony structure. It's generally more pliable in those younger years, so we can actually get some corrections. So seeing kids early, if you see that there's a problem, a common one is kids are running, playing soccer, and one of the parents might say, oh, gee, he's running or hobbling. And often it is a problem that we can fix. So
yeah, basically looking at growing pains being a number one thing. So basically we look at treating the site of where the growth's occurring by balancing the feet up, or in toes or out toes, things that are quite obvious. Getting on top of them early, beneficial.
Yeah, so yeah, if you think there's a problem, don't put it off. Make an appointment with Sam and myself, and we'll get it sorted.